Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम एम्स नागपुर नर्सिंग ऑफिसर एग्जाम 2020 का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। All the following are a good source of omega-3 PUFA except A. Ground oil, B. Mustard oil, C. Fish oil, D. Corn oil. Correct answer B. Mustard oil. 27. Inadequate intake by the pregnant woman of which vitamin can cause neural tube defect? A. Niacin, B. Thiamine, C. Folic acid, D. Riboflavin. Correct answer C. Folic acid. 28. Acid medium of vaginal maintained by A. Trichomonas vaginalis, B. Staphylococci, C. Dodelians bacilli, D. E. coli. Correct answer C. Dodelians bacilli. 29. Nurse's main priority assessment while caring for the client having spontaneous abortion. A. Hemorrhage, B. Hypertension, C. Dehydration, D. Subinvolution. Correct answer A. Hemorrhage. 30. Passive immunity against tetanus is obtained by the administration of A. DT, B. TT, C. DPT, D. Tetanus immunoglobulin. Correct answer D. Tetanus immunoglobuli. 31. The system of evaluation where an employee is measured against his her coworker is called A. Ranking, B. Critical incidents, C. Reports, D. Graphic records. Correct answer A. Ranking. 32. Nursing care that is based on identifying and meeting the needs of a patient is called A. Higger sign, B. Goal-oriented, C. Client-oriented, D. Prioritization. Correct answer C. Client-oriented. 33. When palpating a abdomen of hypertrophic pyloric stenosis infant, the nurse finds A. Rhythmic peristaltic waves in the lower abdomen, B. Distended colon, C. An olive-sized mass in right upper abdomen, D. Marked tenderness around the abdomen. Correct answer C. An olive-sized mass in right upper abdomen. 34. OSCE means A. Observation subject clinical examination, B. Objective structured clinical examination, C. Objective subjective clinical examination, D. Observation structured clinical examination. Correct answer B. Objective structured clinical examination. 35. Maize is deficit in A. Threonine, B. Tryptophan, C. Methionine, D. Leucine. Correct answer B. Tryptophan. 36. The following delusions are common in depression except A. Delusion of nihilism. B. Delusion of persecution. C. Delusion of grandeur. D. Delusion of poverty. Correct answer C. Delusion of grandeur. 37. Nursing has a code of ethics that professional registered nurses follow and A. Protects the client from harm. B. Improves self-health care. C. Defines the principles by which nurses provide care to their clients. D. Ensures identical care to all clients. Correct answer C. Defines the principles by which nurses provide care to their clients. 38. Motilin is secreted by cells in A. Liver. B. Pancreas. C. Esophagus. D. Ileum. Correct answer D. Ileum. 39. The patient has to undergo a loop electrosurgical excision procedure (LEEP). Which of the following represents the potential long-term complications from this procedure? A. Cervical incompetence and cervical stenosis. B. Constipation. C. Hernia and intraperitoneal adhesions. D. Abscess. Correct answer A. Cervical incompetence and cervical stenosis. 40. Socialization into one's primary culture as a child is known as A. Unculturation. B. Biculturation. C. Acculturation. D. Assimilation. Correct answer A. Unculturation. 41. Rorschach ink blot test, thematic apperception test are based on the phenomenon of A. Observation. B. Projection. C. Identification. D. Transference. Correct answer A. Observation. 42. Hygiene factors and motivational factors are key concepts in A. Expectancy theory. B. Goal-setting theory. C. Hertzberg's two-factor theory. D. Maslow's hierarchy of needs. Correct answer C. Hertzberg's two-factor theory. 43. The characteristic of an ideal normal distribution curve is A. Bell-shaped. B. It's symmetrical around the mean. C. Prescription. D. Mean, median and mode do not coincide. Correct answer A. Bell-shaped. 44. Modern concept of chemotherapy was proposed by A. Jospe Lister. B. Mechnikov. C. Paul Ehrlich. D. Frankel. Correct answer A. Jospe Lister. 45. Epidemic dropsy is due to A. BOA. B. Sanguinarine. C. Ergot. D. Aflatoxin. Correct answer B. Sanguinarine. 46. The continuing process of measuring services, products and practices of an organization against the strongest competitors in quality control and quality assurance is known as A. Quality improvement. B. Benchmarking. C. Auditing. D. Quality assurance. Correct answer B. 47. The genetic material, deoxyribonucleic acid, DNA, is contained in A. Chromatin, B. Nucleoli, C. Chromosome, D. Nucleus. Correct answer D. Nucleus. 48. Ketone bodies are found in urine of patients with uncontrolled diabetes due to A. Increased metabolism of fat, B. Decomposition of excess sugar in blood, C. Impaired kidney function, D. Increased metabolism of protein. Correct answer A. Increased metabolism of fat. 49. The best and safest method of sterilization is A. Immersion in chemical germicide, B. Flaming, C. Autoclaving, D. Boiling for 30 minutes. Correct answer C. Autoclaving. 50. What is the major nursing responsibility when administering sulfonamide preparation? A. Monitor child's temperature, B. Weigh the child daily, C. Give milk with medication, D. Administer the drug at prescribed times. Correct answer C. Administer the drug at prescribed times. कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। And don't forget to subscribe. Thanks for watching. See you in next videos.